Why did you decide to join us today and talk to parents about this? Isabel, we'd like to start with you. Can you tell us a little bit about why you wanted to speak to parents through this panel today?
Good evening, everyone, and thank you for having me tonight. I am honored to be part of this panelist. To me, it's very important as a member of my community to lend my voice and my experience, and part of my responsibilities as hunger-free member is to help my community to be informed. So this helps me to give my experience and my voice to other parents like me that are struggling with the decision of whether or not they should put a vaccine to their child. Thank you.
Thank you. We appreciate you being here today. Dr. Archibald, as a pediatrician with over 25 years of experience, has there been recent events that have compelled you to speak on this panel today?
Evening, everyone. And again, thank you so much for inviting me to participate. And thank you all for all the parents and families that are attending. I think it shows something so important for you to take the time out of your evening to come and discuss this very important issue. What I would say is, we really should recognize how far we've come over the past 2 years with regard to COVID. But I think what's also very important, and this is why I really was very excited to participate this evening, there's still so much that can be done. I think it's very important for us not to let our guard down. It's still very important for us to focus on the different ways that we can protect our children and our families. My background is both from public health, looking at infection control and disease prevention across the whole community, to where I'm working now. We're working with individual parents and families to take care of their children on a daily basis. And I think it's so important to be able to focus on the fact that the vaccine is something that's out there. It's something safe, it's effective. We still have to do our other important preventive measures, such as keep washing our hands, wearing our masks. But it's so important the fact that we have this vaccine available to us, and it really is an optimal time for us to then have this discussion and hopefully promote more families to have their children vaccinated. So I really do appreciate you giving me the opportunity to speak tonight. Thank you.
Thank you so much for your input, Dr. Archibald. Ms. Bella Kapinski, our parents checking in today have concerns beyond the clinical aspects of COVID-19. The policies in schools, as we all know, regarding COVID-19 has impacted parents as well. Why did you choose this opportunity to speak with our parents today?
Thank you for having me here today. It's so great to see so many parents and families join us this evening. I never pass up an opportunity to talk to our fantastic parents and families in New York State. I'm a parent myself. I have a 28-year-old son and a 12-year-old. So 2 ends of the spectrum. And so I know what it's like going through this COVID pandemic with a child. My youngest son also suffers from an anxiety and tic disorder. So he had some unique challenges, especially during isolation and with socialization and some of the things that we see in our school buildings. So it's a really, really great to hear from parents directly on your concerns, answer questions that you may have. I sat on then Governor Cuomo's and Governor Hochul's Reopening Schools Council and the State Education Department's reopening committee. So I really understand a lot of the reopening rules and a lot of the rules that are affecting you and your school buildings. So I'm hoping I can be able to answer some of those questions, give you my email. If you have any other questions, I'm happy to connect with you directly.
Thank you so much for that. We are really grateful for your presence this evening. Lastly, Professor Teasdale, you've conducted research on the impact of the COVID-19 pandemic on pediatric populations, as well as regularly speak to graduate students on this matter. Why did you decide to speak with us today?
Well, again, like everyone, thank you so much for inviting me to participate, and welcome to all the families. I'm participating because I care about kids and I care about parents. It's the focus of my research, but I'm also a mom. I have a 6-year-old and a 4-year-old, and I feel really relieved that my 6-year-old is vaccinated and protected. I can't wait until my 4-year-old can get vaccinated too. I want all kids, like all of you, to go back to just being kids. And the best way we can do that at this point is to get as many kids and adults vaccinated as possible. So I really want to participate so that I can help, give information that may help parents make a great decision for their families.
Thank you, Professor Teasdale, and thank you to all of our panelists this evening. As you can see, there is really a wealth of knowledge and such diverse experiences here. It's exciting to have all of this all in one place for parents and caregivers. Our audience can finally get the answers to the questions that they have asked in order to make informed decisions about the health of their children. Thank you to everyone who submitted questions for our panelists when they registered. We've collected these questions ahead of time so that we can answer as many as possible. I think we should begin. Dr. Archibald, some parents have decided to wait and see whether or not to vaccinate their child. What are the risks or benefits of waiting to be vaccinated?
I think that's an excellent question. The vaccine has been out since December 2020, so still, relatively new if we think about the way that vaccines are. But I think it's also important to think about the fact that we're still in the midst of a global pandemic. With regard to COVID, we're still seeing new cases every day. So I think that when we say we want to wait and see, I think the question is for how long? Because again, we still are seeing children. I'm working in a clinic every day, and I'm seeing children still being detected with COVID. I'm seeing newborn babies who are found to be COVID positive because their moms have had COVID just right at the time of delivery. I'm seeing very severe outcomes with regard to COVID. And I think that it's important for us, again, to reflect on how far we've come. So we're not where we were at the beginning of the pandemic, and I feel like things feel a little different, that we feel like we can let down our guard. Masks are not required, they're optional now. So I think that gives a false sense of security that maybe the pandemic is over. But I really hope that parents tonight realize that it's not. We're still seeing very severe complications. So I think that when we think about waiting and see, then we really have to think about the fact that we do have something that can prevent our children and our families from getting infected with COVID, that it's very important, I think, just to take the opportunity to go ahead and vaccinate the children, because it's something that you can do. So with the wait and see, I think it's more than the risk outweigh the benefits. So the risk of getting COVID, even though we hear a lot about the fact that children might get mild cases of COVID, or sometimes people say, well, somebody was vaccinated, but they still got COVID. All those things are true, but what we're finding is that the individuals who are more likely to be hospitalized and in the ICU are those who are not vaccinated. Those who have had the vaccine and got COVID, they have a much milder case. So I think that what we have the opportunity to do, nothing is 100%, but we have the opportunity to protect our children and families from getting COVID at all, or if they do, it'll be a much milder case. So I definitely think that it's really the time for us to promote more vaccinations, just so that we can hopefully get rid of COVID, in our communities.
Thank you. You mentioned that you were seeing a surge. You're still seeing lots of cases coming into the clinic. And along the same vein, Dr. Teasdale, considering the Omicron variant and the breakthrough surge and infections that it has caused, do vaccines still control the spread of the virus and protect others in our family and the community?
This is a good question. And the answer is yes, that COVID-19 vaccines do provide protection even against the Omicron variant, which we know is easier to get than the Delta variant, which we had last summer and fall, and the Alpha variant, which was the original variant that we had early in the epidemic. While studies are showing that the mRNA vaccines that we have, the Pfizer vaccine, the Moderna vaccine, are somewhat less effective at preventing infections from Omicron in adults and children, they still do prevent a lot of infections, and they're very effective at doing what they were really designed to do, which was to keep us from getting very sick or dying from COVID-19. How do we know that the vaccines are effective against Omicron? The US Centers for Disease Control and Prevention, the CDC, released a report in the past few weeks with data from December of 2021 and January of 2022. So when Omicron was really becoming the most common type of COVID that was going around. And we see from those data that unvaccinated adults are 3 times more likely to be infected with COVID than vaccinated adults. So there's still a big protection from the vaccines. There is newer data from New York City showing that in children 5 to 11, the effect of the vaccine is a little bit lower than in adults, but it's still protective. There was also a recent study done in Denmark that looked at household transmission. So households, the getting infected from someone you live with. And we also see good protection from the vaccines, particularly for people who had their booster shots. So if you're vaccinated, and especially if you're boosted, you will get protection from getting infected from COVID-19 from the vaccines, even though we have Omicron.
That actually lends itself to the second part of this question. It's kind of like a 3-tiered question, actually. So some parents are wondering if they should still get their children vaccinated despite the surge. And if they should get vaccinated, can they get COVID anyway?
Right. So you hear about breakthrough infections, which is of an infection that occurs after vaccination. We know that these are more common as you get farther from the time when you were vaccinated. So there's very strong protection immediately after vaccination. And then about 6 months after that is when you need to get a booster shot and get that vaccination again. So it is possible. We know that with the Omicron variant, that children who are 5 to 11 who are unvaccinated are twice as likely to be hospitalized than vaccinated children. And for adults, it's 5 times that. So there's a really good reason to get vaccinated, which is that you don't want to get sick. Even if you do get infected, the vaccines may not prevent everybody from getting the infection, but they will prevent most people from having severe disease. And keep in mind that the COVID vaccines are not that different from a lot of other vaccines we use, which also don't prevent everybody from getting the infection, but they prevent severe disease and illness. And that's really what we want to do, so that we can make COVID, even if it sticks around, we can make it a mild illness that doesn't make people very sick, that allows people to go on living their lives, and doesn't overrun the hospitals that Dr. Archibald is in. We want to keep those open, and we want to keep everybody safe and healthy.
Thank you. Ms. Bella Kapinski, for a lot of parents, the school-based COVID-19 policies are very confusing. I know firsthand, I work in a school, and it's even confusing for me. It's hard to understand the protocols of the ever-changing quarantining, the policies around teachers returning to work, and the procedure for positive cases. What are some plans that are in place for when a parent or a child have contracted COVID? What should they do when they get infected, and how are these protocols determined?
It's a great question. So I want everyone to know that New York City Department of Education, because I think most of us are New York City parent families, has resources on their webpage in both English and Spanish, and then you can translate into other languages. And I want to tell you where those are. And if you go to the New York City Department of Education webpage, and then they have a school life section, it's called, on their webpage. And underneath there, they have an entire health and wellness section that focuses on COVID-19. And they actually line out all of the rules that New York City has about isolation and testing and vaccines. So if you're not familiar with that webpage, it's a really good resource. They do keep that updated. Rules change very frequently when it comes to, the rules about isolation, I can't say that word tonight. Isolation, the rules about quarantining, the rules about masking. It really changes lately on a every couple of week basis. So New York City Department of Education and most school districts, and if you're not in New York City, your local school district probably has these on their webpage too, has rules about what's happening in your school building. I'll tell you, it's very confusing as a parent because it changes frequently. A great source of resource is your building principal, always very helpful, or your local parent organization, or I know New York City uses PTA or PA as well. They may be able to tell you information too. But again, check out that New York City Department of Education webpage. Again, it's in the school life section, there you go, and health and wellness. And then in that health and wellness section, there's a COVID section. And then in the COVID section, there's a whole bunch of information on there. In particular, in that COVID section, there's a section called health and safety in our schools. And it kind of talks about all of the information that is the rules that pertain to New York City and the school system there. New York City, interestingly, has a little bit different rules than the rest of the state. So probably because the school system is so big in New York City, we have so many school students in New York City. We have about 1 million children in New York City public schools. The rest of the state has about 1.6 million children. We have 2.6 million children in the whole state. That's your best source of information, or your child's teacher or their principal. I will say on vaccines as well, your best source of information is always your child's pediatrician. And it's really, really important to ask that question and really have a meaningful conversation with your family about whether or not you're going to vaccinate your child and what that means for your child. You know, my husband and I sat down. I had COVID very early on, back in November 2020, and I only have one lung. I was a fireman at Ground Zero, and so I suffer from some 9/11 related illnesses. So when I contracted COVID, my doctors, I'm treated at Mount Sinai in New York City, were very nervous, and they said very high risk I was, and they were worried that I would end up on a ventilator. Thankfully, I pulled out of it okay, but you know, having gone through that, when the vaccine was available to my child, who is obviously 12, my husband and I sat down and had the conversation with ourselves. We also had the conversation with him because he was old enough to have that informed, opinion of what he wanted to do for a vaccine. And then we met with our pediatrician. And I think it's really important that every family, whether or not you've made that decision or not, that's the conversation that you have to make. Of course, it's your choice. It's really important to have that informed choice, though. You really want to talk to your pediatrician. They're going to have some really great information you can use and to help you really make that decision for you.
Thank you so much for that wonderful advice. That brings us actually to Ms. Vera. So along the lines of being a parent, what was your thought process when you were hearing that the COVID-19 vaccine was eligible for your children? Can you describe your thought process as well as your initial reaction and what your reaction was?
Yes, definitely. I think as a parent and as someone that works in the school system also, it was very scary times, right? And when you don't know and you are just hearing rumors from other parents, from relatives, from family members, you're getting all this information and sometimes it's misguided. So I had to really think about what was important for me and for my family. And just like Kyle said, the first thing I did was I reached out to my pediatrician and I had that conversation about both of my kids. You know, what can I do? How safe is this? What do you know about this? What do you think? And she was nice enough to share her experience and her thoughts. And that gave me a sense of relief because then you're talking to a professional, you're talking to someone who's reading all of these data and all of this information on it, right? And you feel that there's a hope, because back in 2020, everyone was, so scared. I was so scared of, what if I would not even visit my mom, because I was like, oh my God, if I'm carrying something and then my mom gets sick, I'm going to feel so guilty. And then I was telling my kids, you have to be careful, wash your hands. We cannot visit grandma. So it was all of these things that you start thinking. And then when the vaccine came out and I had enough information, then I said, you know what? I have to do it first because I have to set the example for my kids, right? And let them see that there's nothing wrong. It's okay, because the news and everybody talking about what could happen and all of this misinformation out there. And then I told my kids, okay, now it's your turn. Now we need to do this, and we're doing this to protect you, to protect my mom, to protect everyone around us, because we need to continue our lives. We need to try to get back to whatever normal needs to be now for us. So the thinking process, it wasn't overnight, but it was to do research and to talk to people who you trust and has the correct information.
Thank you. Dr. Archibald, a lot of parents have a lot of questions around natural immunity. So one question is, if I or my child already had COVID-19 and we've recovered, do we still need to get vaccinated? And is natural immunity itself the best protection?
And I think that's another excellent question, because the one main issue with that is that you can get COVID again. And there might even be people who are here today who've gotten COVID more than one time. So I think that it's different from some other diseases, that once you get it, your body mounts enough immunity from a natural infection that natural immunity, lasts with you, pretty much your whole life. Very different with regard to COVID. With regard to COVID, your body definitely does respond, but what we found is that antibodies don't last. They don't last. So even though maybe right soon after an infection you have the immunity, the antibodies don't last in your system to give you lifelong protection. So that's another benefit with regard to the vaccine. So with regard to the question, even if you've had COVID, and I would say maybe especially if you've had COVID, you really don't want to get it again. So that it's really a good idea, after you're fully recovered, from your symptoms, that you go ahead and get vaccinated. Because the vaccine definitely has been found to offer longer protection than natural immunity in and of itself.
Thank you for clarifying. Professor Teasdale, a lot of parents are definitely asking, with regard to children and adults, what are the rates of the following: transmission and cases between vaccinated and unvaccinated persons, hospitalizations within those two populations of vaccinated and unvaccinated, and deaths?
Yeah, those are good questions. We mostly have sort of overall data, so it's not usually broken out for kids and adults, but I do have the most recent New York City data that were available that I wanted to share. So in terms of cases, and these are data from January and February, in the rate of new cases, meaning the number of new people who are newly diagnosed, for vaccinated people is around 209 people per 100,000. That's how that's expressed. So about 100,000 people, we're seeing about 209 of them getting infected if you're vaccinated. If you're unvaccinated, it's about 756 per 100,000. So it's 4 times higher. So those numbers might not be that meaningful, but understand that the risk that you have from getting a new infection with COVID-19 while we have Omicron is 4 times higher than if you're unvaccinated compared to if you're vaccinated. So that's new cases. For hospitalizations, the numbers get even bigger. So for hospitalizations for vaccinated people, it's around 6 per 100,000, but for unvaccinated people, it's 37 per 100,000. So it's 6 times higher if you're unvaccinated versus being vaccinated. And then for deaths, we're seeing about 1 death per 100,000 person among vaccinated people, so pretty low. For unvaccinated people, it's 6 per 100,000. So you have 6 times the risk. And again, this is data during Omicron. So we know that the vaccines are still giving us protection from infection, from hospitalization, and from death.
Thank you. Those numbers are astounding. Ms. Bella Kapinski, many parents are actually wondering, just around the policies. Different parts of the country have different policies on masking and vaccinating school-aged children. In New York City in particular, how are these policies around masking and vaccinations made? Can you tell us a little bit about that process, like who's consulted and exactly how these decisions are formulated?
Great question. I'll say it's reasonably complicated, but it's pretty thorough. So when COVID started, the Governor Department of Health pulled together for schools a bunch of us type of people, right? So I've been around, this is my 24th legislative session. I know I must have started when I was 5 years old. So I've been doing this a long time, and I've been in schools a long, long time. And so the governor's office said, we really want a parent voice when we talk about this. And then they talked with the teachers union, and they said, hey, teachers, who can join us? So Randy Weingarten, as example, she's the president of the AFT, the American Federation of Teachers, joined us on our committee. And then we had classroom teachers and principals and school district leaders and school board members, and we had representatives from different diverse communities really join us to try to talk about the reopening plans for schools and what did it look like for then, but then we had no choice. We were closing schools and trying to get them reopened. And then when we, had schools reopened, we had to focus on both in helping students learn, right? And what we call academic recovery. So trying to kind of help students make up what they lost during the time. So that's really important. So we worked with a lot of teachers and a lot of literacy people who are really important, so we could get students help in reading, which is so important. And the number one thing that helps a student is learning to read and reading books. So always read to your children. And then we worked with our Department of Health and our local county departments of health and medical doctors and different physicians who are really doing the work and researching COVID. We met with Anthony Fauci as example, and we met with the CDC, and we met with all of these people who really talk to us as educators and parents and families to say, here are the health things we have to figure out. So it's a complicated process, and a lot goes into it. So when the Department of Health makes these rules, they convene all of us. They get all of the educators together. They get families and parents together, and our state education department, who is the overseer of all of our schools in New York State, and New York City Department of Education and different school districts from around the state. We all get on a big Zoom. We don't still meet in person because of COVID. So we all get on a big Zoom, and we'll meet for hours at a time and talk through these issues and say, is it safe for children to be unmasked? Is it safe for masks to be optional? What are the safe rules for I still can't say that word today. And quarantining. So we kind of come to an agreement based on, what the CDC is telling us, based on what our own Department of Health is telling us. Every single morning, I get an email from the governor's office and Department of Health, and they tell me the COVID cases for the day. They tell me the positivity and the negativity rate. They tell me something called, I don't know, Dr. Teasdale talked about it, the reproduction value, the R value. They tell me the hospitalization rate. They tell me the death rate by county. So every morning I wake up and I look at the COVID numbers for the day. And if I feel like I'm worried about something, then I call the governor's office and I call the Department of Health and I say, hey, is this a spike? Is this a trend? We're seeing a spike in this county. And every afternoon, I look at the school COVID numbers, because all of our school districts have to report their COVID cases into a COVID portal for the state. So every afternoon, I look through our state's COVID numbers and I see if there are trends in certain school districts, or are we seeing COVID spikes in certain areas. So every morning and every afternoon I do this because it's really important work. There's nothing more important than the health and wellness and safety of our students. At the same time, it's a balancing act, right? Because we have to get students, fantastic students, in front of our wonderful classroom teachers in their seats in school buildings. So we work together as a team, really. The education system, parents and educators like me who really have dedicated a lot of their time to making sure our students are the safest they can, working with our Department of Health, the experts in the health part of it, who were then working with our state education departments and our school districts, who were the experts in the education part of it. It's like a big marriage, right? We all meet almost every day to talk about this stuff, to make sure that we have the best guidance and the best advice out there to keep our kids safe and learning in our school buildings. I hope that answers. It's kind of complicated, but it's very important work.
It does. Thank you so much for elucidating. It's pretty fascinating how many moving parts are involved in this decision-making process. So
We all
thank you
kind
so
of vote sometimes. So do we like that? Do we not like that? Do we think that makes sense? So it's really, really important that, you know, education system listens to the health system. One thing I know we're all facing as parents and families and educators is the mental health of our students, because we've seen that really be negatively impacted during this pandemic. So that's one of the reasons why we felt, everybody, health experts and educators felt it was really best to get all of our kids back in a school building as quick as we could.
Thank you so much. Ms. Vieira, before you mentioned that you had gotten vaccinated and then you set the example for your children. So these days, just anytime actually, parents can be overwhelmed with making appointments for their children, just in general. The thought of making another appointment for a vaccination can be daunting. What was your experience in making an actual appointment for your children, and how did you go about making it?
Well, I had two choices. I could have done it with the pediatrician, and then I had Lincoln Hospital in the Bronx. They have the vaccination site. So I selected to do the online appointment. So it was good to be able not to be on the phone waiting for someone to pick up the phone. It was an ease for you to go into the website and pick up the time and date that you wanted to go. And then once I got there, then they gave you the forms to fill out, they register you, and you went and you saw the nurse. The nurse was kind enough and gives you information, you know, about the vaccine, and they ask you, do you have any questions before they even administer the vaccine? And then we went to a waiting room to see if there was any reaction. So the process is very smooth. And yes, of course, the vaccine is still free. I did not have to pay anything. There was no co-payment, there was nothing. And it was just you to be registered because, you know, we need to collect that data of the people who are getting vaccinated. But it wasn't so difficult to go through the process.
That's good to know. Thank you so much. Dr. Archibald, some folks are weighing the pros and cons of the vaccine as well as possible side effects, either from the vaccine itself or from contracting COVID-19. What are the side effects of the COVID-19 vaccination, like vaccine, versus actually contracting COVID-19 with a child who's unvaccinated?
Yeah, I think it's important to know, you know, whenever a child is getting vaccinated, you know, it's required that we speak with a parent, give them information. There's a vaccine information sheet that goes through all the different possible side effects. What I would say is that there's similar side effects with all vaccines, COVID vaccine as well, you know, with regard to possibility for a fever, possibility for soreness in the arms. A lot of those are the same reactions that you could get from any vaccine. You know, there have been very, very rare cases with regard to a heart condition, and maybe some people have heard about that with regard to the vaccine. It's been very rare. I think it's more so in maybe teenagers, more so in teenage males or young adults, not really seen in children. But there was a recent study that came out that actually looked at that question, and they found that there was a higher risk of that heart condition if you didn't get vaccinated and you got natural COVID infection than if you did get vaccinated. So I think, you know, one of our main messages is that you're more likely to have side effects from getting the COVID infection directly than the vaccine. And I think then the other thing that's real important as well, because sometimes we say, well, you know, right now there's not as much of a fear with regard to getting COVID, I find, as there was a couple of years ago. You know, there was a lot more fear. There was a lot more, obviously, you know, everybody was, you know, socially isolated. Everything was shut down. So there was a really different time than I think it is now. Now I find that families are, you know, it doesn't seem to scare them as much because, you know, we have the home test kits and, you know, all these different things, and we don't really see what we saw 2 years ago. But again, I think it's important that we don't let down our guard because what we do find is that even for children who might have mild infections, they're still at risk for other complications, you know, from having COVID infection. In my practice, I can think off the top of my head of 2 children that had the multi-inflammatory syndrome, where they had inflammation of different organs in their body as a result of COVID infection. And these were children that were healthy. They didn't have any pre-existing conditions. And after they got the infection, and some other family members did as well, but they were the ones who ended up in the ICU, and they're still being followed by the specialists, with regard to that. We've seen children, especially teenagers, who are getting the long COVID. Some people might have heard of that, and again, it's not connected to whether or not you had a severe case or you didn't. You could still have a mild case of COVID and then still experience long COVID, which are basically symptoms you have for many months after your infection resolved. And some of those might be even similar to feeling like you still have COVID. They have something related to long COVID that's known as like a brain fog, where you can't concentrate. And I think that's especially relevant for our school systems too, okay? With regard to, the importance of sending children back to school to normalize educational environment. And then now you had COVID and it's still affecting your ability to learn. So I do definitely think that, we don't want to, again, let our guard down to say, well, we're not seeing as many cases as before, or some of the cases among children are milder, because we really don't want children to have to go through having COVID at all, but also just it puts them at risk to have these other much more severe complications, that those are things that really can last with them, and that can be something more chronic. And I think that it is important to have the discussion. I have the discussion about the vaccine, with my families in our clinic, on a regular basis, and I'm glad that they bring it up. So if you haven't had the conversation with your pediatrician, please do, because we really do want to have that open dialogue, because again, our main point is that we really want to get as many children vaccinated as possible, because we don't want them to have to go through, some of these complications, that could have been prevented.
And can I add to what Dr. Archibald just said? Because I actually check the daily myocarditis rates is one of the things that I look, and I looked at today's rates as and I just happened to have them in my mind. And so for those teenage boys she was talking about, sometimes you hear it because we get a lot of parent questions about that. Well, I have a teenage boy and I read in the paper that there's this thing called myocarditis. Well, so if you are an unvaccinated teenage boy and happen to get COVID, the rate for you to possibly get myocarditis is 51 in 100,000. But if you are a vaccinated boy, it's 22 in 100,000. So if you're unvaccinated, the rate is double. So what Dr. Archibald said is very true, is that, that really isn't a reason not to get the vaccine. So, so that heart condition that parents worry about, I worried about because I have a teenage boy, right? So it's something that I had to think about. So I did my own research. I talked to my pediatrician. Now I have a little bit of insider information, right? But I realized that Jackson, who's my son, had a higher risk of developing this very, very rare. It's very rare. Okay, let me say that. It's very, very rare heart issue that goes away if he was unvaccinated and got COVID than if he actually got the vaccine. So it was safer for my son, and we decided to vaccinate my son. Safer for him to get the vaccine because it actually protected him more against that heart condition. So thanks for bringing that up, Dr. Archibald, because we hear that a lot from parents, a lot about that, because I get it. We're parents, and I know Isabella, I'm sure, worries about that too. We worry about these things. We hear these things on the news makes them out to be a big deal. And that's why I said it's really important for you guys as parents and making these decisions, talk about it as a family, but talk to people like Dr. Archibald and talk to your pediatrician to really get the inaccurate information so you can make that informed decision.
Thank you. In discussing risk factors, a lot of parents are wondering, especially for children that do live in different parts of New York City, like the Bronx or Harlem, where there's like high rates of childhood asthma. Can children with asthma and allergies be vaccinated safely? Is there a risk of more of an allergic reaction from getting the COVID-19 vaccine if this is the case?
Children with allergies and asthma can be vaccinated safely. I think that's definitely the message that we want to convey. And I think it's also important to know that, children with asthma specifically, similar to other underlying respiratory conditions, they're more likely to get more severe cases from COVID. So I think that it's even more important than if you have a child who has asthma or other certain chronic conditions for them to get vaccinated, because the likelihood that they could have a worse condition if they get COVID is going to be more than if they did get the vaccine. Again, allergies, a lot of people have allergies in general, seasonal allergies, which I think a lot of people have. But if we're talking about allergies to a component of the vaccine, I would say that that's less common. If somebody did have a vaccine reaction and that is reported, there's a national data reporting system called VAERS, where any type of reaction has to be reported. And it's even more important now because, the COVID vaccine is still, relatively new as we think compared to other vaccines, so that we have to continue to report those conditions just so we can track and see how common they are. But if anybody had an allergic reaction to a component of the vaccine, I think that's a different conversation of whether or not they should get subsequent. But more likely than not, it would be just a concern of, let's say, if they have certain types of allergies. Those I would say also, that it's very important because sometimes allergies will mimic COVID. And we'll have families saying, well, I think it's just allergies. And then we do the COVID test and they're positive for COVID. Right? So there's a lot of overlap of symptoms. And again, I think the main message is, do what we can to prevent our children from getting sick. I think that's our main message. Let's do whatever we can do. Before it was, wash your hands, wear a mask, and stay away from everyone, right? So thankfully, we're out of that phase. But now it's really wash your hands, wear a mask, and get vaccinated if the vaccine is eligible, for your age group.
Thank you. That's very poignant. Along the lines of what parents might be thinking, I know myself working in a school, a lot of parents are basically saying, they're expressing sentiments like every adult in the building is vaccinated already. Why would my child need to be vaccinated if everyone else, like all the adults are? How would you go about answering that, Professor Teasdale?
That's a good question. I'll say a personal anecdote first, which is that my 4-year-old is not vaccinated and has to quarantine this week because a fully vaccinated and boosted teacher at his school got tested positive. So she'll probably be fine because she's well protected. But now I have a kid out of school because he's not vaccinated. But the main reason that you want to vaccinate your kids, and the main reason I vaccinated my kids, is to protect them from severe disease, from getting very sick, and from dying from COVID. So even though kids are less likely to get seriously ill from COVID, and we know that, and we've been hearing that since the beginning of the epidemic, it's a little bit deceptive because you can't predict, as Dr. Archibald said, you can't predict which kids are going to get very sick. And COVID has infected a lot of kids. Let's remember that since the epidemic began in March of 2020 in the United States until the end of March this year, 13 million kids have tested positive for COVID. And that means many more actually had it. That's just the number who tested positive. It's not the actual number of kids who were infected. There were over 27,000 new COVID-19 cases just last week, in the last week of March in the United States. That's a lot of new infections in kids. 41,000 kids have been hospitalized and 1,000 have died. I know that 1,000 number doesn't sound as big as the number that we hear for adults, but let's remember that we don't expect children in the United States to die from an infectious disease. This is not a common thing. So that number is quite shocking, and it actually increases the number of pediatric deaths significantly for the past couple of years. Dr. Archibald already talked about the fact that totally healthy kids can get sick, and that's really the best reason to vaccinate your kids, because you don't know that your kid isn't going to be at risk for that. And we also have long COVID. Fortunately, as Dr. Archibald mentioned, that is a terrible side effect that can go on for a long time after infection. We are seeing evidence that being vaccinated prevents long COVID. So having the vaccine, if you still get infected, you're much less likely to get long COVID. We also know that children can spread COVID, right? And they're less likely to have symptoms. So they may be more likely to spread to siblings who might have underlying health conditions, and also to older adults, to our grandparents, who we want to be able to go visit, who may be vaccinated, but in whom the vaccine isn't as effective. And so we want to protect our family members. I also want to reiterate the importance of getting all adults vaccinated. So it may be true that all adults in schools are vaccinated, but a lot of adults in the community still are not. And a very sad statistic is that it's now estimated that about 200,000 children in the United States have lost a parent or a caregiver to COVID. That is an epidemic, another epidemic on top of an epidemic of children who are processing profound grief and are orphaned in some cases. And so we have to protect, we have to take care of ourselves, exactly as Isabel said. We have to be protecting ourselves as caregivers so that we can be here to take care of our kids.
Indeed. And discussing just the vaccine itself, Ms. Vera, if you can just tell us a little bit about the provider that administered the vaccine to your children. Was it similar or dissimilar to any other vaccination appointments for your children?
Yeah. So, you know, it was funny, right? When as a parent and that you're not in the field, all of these thoughts goes in your head and you don't know, right? You hear vaccine is something new and you've taken your children to get the vaccine, but these are vaccine that's been around for such a long period of time. And now you're going to this new vaccine. And I was like, okay, what am I supposed to expect? And what am I supposed to be looking out for? You know, is it gonna hurt them? All of these questions comes up, but it was just like any other vaccine. You know, it hurts when they poke you and that's about it. I don't know if there's a trend also whether on the males, it hurts less than the females because my boys were like nothing, that, you know, it hurt a little bit, they had a little bit soreness and then like an hour or two, they were fine. Like, you know, nothing happened. And here I am, when I had my vaccine, I was like, oh my God, like it hurts. But I was glad that their experience wasn't also what they had in their head because of everything they've heard, you know, in the news and the friends, because you know, the kids also, they get scared. Like we speak in the house and we're thinking our children are not listening, but they are listening to everything that's been said, and they start feeling and believing certain things. So when they went in, they saw that it wasn't so much of a big deal of getting the vaccine, you know, just a poke and you're out and you're done. So it was pretty easy.
That's comforting to hear. Dr. Archibald, parents are actually asking, and many of them are actually asking, what exactly is inside of the COVID-19 vaccine? And can you contract COVID-19 itself from being vaccinated?
So, you know, with regard to the last part of the question, no, you cannot contract COVID from the vaccine because there's not pieces of COVID in the vaccine. Basically, what the vaccine is trying to do is trying to make your body then develop an immune response so that it would be as if your body had come in contact with the actual virus. So what's in it, and I think a lot of people have focused a lot on this piece of it, so I think it's important that we discuss it. It's a mRNA, which is basically a messenger RNA type of a molecule. It doesn't go into the nucleus of a cell. And what does that mean? It doesn't affect the genetic composition of a person getting it. And I think that's a very important piece of it, because I've heard a lot of questions that wonder, you know, is it going to affect my genetics? Is it, especially to give to a child who's in puberty, is it going to affect their puberty? Is it going to affect, you know, the onset of menarche, of having their period? You know, what is it going to do to my child? So I think it's very important to know that it doesn't go into the nucleus. It doesn't affect the genes. It doesn't have COVID in it. But what it's really trying to do is have your body develop something that's very similar to what COVID has. So COVID, and a lot of people probably seen an image of COVID as kind of a ball that has these different, you know, spikes kind of coming off of it. And those are different types of proteins. So what this vaccine is trying to do is basically to try to get your body to develop those types of proteins and then develop then an immune response to it, so that when you come in contact with COVID, the virus, then your body is already immune to it. So that's really what it is, you know, and I think that it's just important to know that. because I think that there's been so much discussion about how different that this vaccine is. And I think that that's why we want to have conversations like this, to really dispel a lot of the myths, with regard to it, that you're not going to get COVID from it. That's a main message there. It's not going to affect the genetics of your body or your child's body. I think that's important as well. And I think the other question, because I think sometimes this comes up with it in discussions, what are the long-term effects and what are the long-term implications of the vaccine? And I think at least from where we are right now, the vaccine just came out maybe December 2020, thereabouts. So it hasn't been out that long. So I don't think any of us could really say, what is it going to be, what the long-term effects in 5, 10, 20 years are. I think what we can say is that it's constantly being studied. Just because a vaccine is out, it doesn't mean that they're not looking at it anymore. The vaccine first went out more as what we call an emergency use, something that was out in an emergency. We needed to have something to help, stem the tide of this infection. But then it still had to keep going under review by the FDA before that emergency use was basically changed to now this is an acceptable vaccine to use, not just when we say it's an emergency. So these vaccines are constantly being studied, even though they're out. There are other vaccines that are being studied as well. And that's the reason why, when we talk about the under 5 population, that we don't have a vaccine yet, because they're still studying that. And they really want to make sure that the research really shows that once it comes out, it's gone through all the rigorous trials to know that it's safe, and it's safe for that age group. So I think it is important to know that once the vaccine is out, once the COVID vaccine's out, it doesn't mean now we're just going to sit back and not, look at it anymore or follow the trends or follow any concerns or questions. It's still being rigorously tracked and studied. So I think that it is something that's important to know about. And there is a lot of great information also on the CDC website, on the State Department of Health website as well, that really tries to break down the information for parents. And I definitely encourage you to look at those resources, because they're trying to make sure the parents understand and to really give the information for a lot of these common questions that have been coming up.
Thank you for clarifying about the safety of the vaccine itself. And actually, one of our questions that we received was, how exactly can it be safe if it's relatively so new? And parents have the feeling that it's developing way too rapidly, and that it's just very untested. So if you could just help us dismiss some of those, beliefs if they're not true, Professor Teasdale.
Sure. So I'll start with a little bit of vaccine development trivia for you, which is that prior to the COVID vaccine, the fastest vaccine ever developed was for the mumps, and that was in 1960, 60 years ago. So a lot has changed. We've gotten a lot faster at developing vaccines. And even though I think for the public, for all of us, mRNA vaccines were a new, we'd never heard of them before COVID, but they've actually been studied for decades, and they've been used in humans as well. So there's a lot of previous research on this technology that was used for the Pfizer and the Moderna vaccine. We also knew a lot about coronaviruses, because this is not the first, this is SARS-CoV-2, right? That's the technical name for it. But there are other coronaviruses that are in the same family that have been studied. And so people were prepared. Scientists knew a lot about very similar viruses and about the technology that could be used. The other reason this happened so quickly is because never in the history of the world has an effort been mobilized with more resources and more urgency. This was a global public health emergency. In general, when vaccines are developed, it's a much slower process because there isn't a pandemic that they need to be, that they're targeting. So the COVID-19 has has infected more people in the world than anything prior. So we are, this was an unprecedented event. But I do want to clarify, I don't want to get too much into the technical aspects of vaccine trials, but all vaccine trials and all drug trials that are done to make sure that something is safe and effective have 3 phases. And all 3 of those phases were done for this vaccine trial. Nothing was skipped. Every piece of the routine puzzle that we go through, or the steps that we go through, I should say, to make sure that things are safe and effective, all of those things were done. What usually how it's done is it's done in sequence. So you finish one phase, phase one, and then you start phase two. What happened with these trials was that as phase one was finishing, phase two was starting. And so there was a little bit of overlap that made it much more efficient. But again, nothing was skipped. There were no corners cut in terms of safety. And just to clarify the issue around emergency use authorization versus approval, the only thing that's different about what's called an EAU, or the emergency authorization, is that the vaccine companies were allowed to begin production of the vaccine before or as the FDA in the United States was reviewing it. And normally you would have to wait to do production until you had the authorization. So that's really the only difference. It wasn't about cutting corners in terms of safety. I think another question that I hear is, why are the trials still going on? Are they still testing this vaccine? And the answer is that they really, even though, as Dr. Archibald said, there will be constant monitoring for any signal that there's any safety issue, but the safety question is very clear. This vaccine is very safe. It's a totally safe vaccine. 11.3 billion doses of the vaccine has been given globally. 218 million Americans have been vaccinated, and there have been almost no adverse events. So it is a very safe vaccine. The trials are continuing, to answer my own question. The trials are continuing, not so much about safety, because we really know that they're safe and we don't expect there to be long-term health consequences, because when there are safety issues with vaccines and drugs, or vaccines particularly, they happen early. So we would have identified those. But the question is, how effective are the vaccines over time? And that's why the vaccine trials are ongoing. We want to see, does the immunity, how long does it last? We know that it wanes now. So they're learning things that they can apply to new vaccines that may be better at preventing, new variants. So that's why the vaccine trials are going on. It's not because the vaccines are still being tested for safety. We know that they're safe.
Thank you. Ms. Kapinski, if you could just, thinking about policies and, how parents have to be vaccinated in order to enter a school building, do you anticipate that this will be the same thing for the next school year?
So that's interesting, because that's a different rule in different school districts. So New York City is, again, a little bit different than the rest of the state. Do I think that's going to be the same rule next year? I don't really know. So we have 764 school districts in New York State, if you can believe it. They all sometimes can create their own rules about things like this. Some school districts, as you're aware, require parents to be vaccinated to enter a school building. Previously, we had to all be masked, of course. Some school districts do not require parents to be vaccinated in a school building. So I think that decision will be made school district by school district. Really looking at the unique circumstances of the district. Again, New York City is the largest district in the country, so it's always a little bit more challenging there. The health and safety standards, I'm seeing a lot of head shaking. The health and safety standards are a little bit more different in New York City. They're very similar, as example, to Yonkers or Buffalo, Rochester, or Syracuse, where we consider our big 5 city school districts in New York State. So those big city school districts kind of have similar policies, where our smaller school districts have different policies because there's a lesser amount of students and a little bit lesser risk. Do I think that's going to be the same next year? I wish I knew, because then I would play the lottery tonight and I would pay for all of us to go on vacation. Look like where Isabel's is right now. But I think, again, these are the conversations that you guys should be having with your parent association in your school building, with your school administrators. Every New York City school building has some sort of parent organization. Every school building outside outside of New York City has some sort of parent organization. And we have great parents like Isabel who are in school buildings doing the work there. So I can't tell you, I don't know what it's going to look like. I know that things change every day. And I know the school district wants parents and families back in the school building. They're doing it in a way that they think is safest for their students. And I think that's what's always most important. And I also want to chime in, it's also important to remember that not every family or parent are going to vaccinate their children. And we want to make sure that those parents and families are still feel welcomed. They're not shamed, that we don't, we don't see bullying in those cases, because we see in some of our school buildings, we do see some bullying and some shaming when that decision is made. So we want to make sure that we are supportive. We are supportive of all children always, no matter their circumstances, no matter their zip code or gender identity or expression, no matter their race or ethnicity or the language spoken, their immigration status. We have to make sure we support all children, and especially whether or not they are vaccinated or not. We can never shame a child. Whether or not they decide to wear a mask or not, we should never shame a child. So we want to make sure on a statewide level that all children are supported, and that we have that conversation with our children, because in our school building, we can choose to wear a mask or not. Some kids wear a mask, some kids don't wear a mask, some kids are vaccinated, some kids are not vaccinated. And we've had that conversation with our son, and I implore you to have that conversation with your children, that their friends may be vaccinated or not, their friends wear a mask or not, but at the end of the day, they're all still friends.
Thank you. Ms. Vera, considering that you are, a daughter, a mother, a grandmother, you work in a school, what would you say to children who ask why they should get vaccinated when adults themselves are actually refusing to be vaccinated? Has that question ever come up to you?
Oh, yes, definitely. From my boys, actually, they talk, they go to school, they have all of this technology, so they talk with their friends. And it was like, why do I have to go? So-and-so is not doing it. The parent is going to do it. As okay, everyone has their own decision to make. It's a personal decision. And this is the decision that we're going to make. This is for us, for the safety of our family. And everyone is going to have to do their research and talk to their pediatrician and find out, what is good for their family. So to me, it was easy enough, because this is something, it's not only about the vaccine, it's many other topics also that the kids compare themselves, right, to other kids. And, why in my household, why don't get to do what other people get to do? So, and in life, it's just that. So it's our decision. This is what we're going to do. And we're going to move forward, and we're just going to pray for everybody else, right? For them to make the correct decision and be able to be protected as we're going to be protected.
Thank you. And thinking about the future, Professor Teasdale, some folks tuning in right now are actually have actually expressed concern with regard to boosters, and is it going to be an endless process of constantly getting boosters? What are the next steps, and where should we think about focusing from going on from here? Also, this is a two-parter. At what point does this just become endemic, and what does that mean?
Okay, I'll answer the second part first, which is the billion-dollar question, and it's a difficult question to answer because we just don't know what's going to happen. People who've tried to guess, it's a fool's game to try to know what's going to happen in the future. And the problem, as you all know, with COVID is that it mutates and we get new variants. And the more transmission we have, the more likely we are to have new variants. So what we want to do is get to what's called an endemic phase, where COVID isn't disrupting our lives anymore. And most importantly, is not disrupting our healthcare system, because we know that during the pandemic, many people missed routine care like screenings and even surgeries that had real health consequences. So we need to stop that, and we need to get back to normal with people having access to healthcare and everything else that we want to do. What the endemic phase looks like isn't clear. It could be that we have some COVID around for a long time, and there may be periodic increases, somewhat like what happens with the flu. The flu goes away. The flu always goes away around April or May and then comes back in October. COVID may act a little bit like that. It's not clear. What we do know is that if we can get enough people vaccinated, it will make COVID a minor illness, which means that people may still get it. But if they're vaccinated, they're not going to get sick. They're not going to need to go to the hospital. And then we can live with it as a mild illness. In terms of ongoing vaccination, the hope is that we can develop a new vaccine or a version of the vaccine we have that provides broader protection and can, outsmart the virus and all of its variants. That would be great. Whether or not that's possible remains to be seen. What may end up happening is something like the flu, where we need to get annual vaccines, annual boosters, in order to keep up our immunity. As Dr. Archibald mentioned, there are other infections where our bodies do not don't learn how to protect us. Something like tetanus, you don't learn how to protect yourself. So we always have to get tetanus shots, right? So this is, COVID-19 is very different as an infection, but there are other viruses, there are other infections that we live with, but we have to manage with vaccines. And unfortunately, COVID-19 may be one of those.
Thank you so much. In light of, what we've all discussed so far, thinking about the anticipation of getting shots and, do you anticipate, Dr. Archibald, that that getting boosters will become a regular part of the regimen for vaccinations for children moving forward?
I definitely want to echo what Dr. Teasdale just said, that there definitely is ongoing research with regard to different types of vaccines. So what does that mean? It means that it's possible the vaccines that we're giving right now might be replaced by other vaccines that actually provide longer amount of time of immunity. So I think that's where the question about the boosters comes in. How long does a vaccine protect us, right? So, with the ongoing studies that are going on, that was the reason where the recommendations came in. Well, this age group needs to get boosted, and now this age group needs to be boosted, and this is a time interval from when boosting should occur, and that's why that we're learning as we go, basically. A lot of times with vaccines, as we talked about the long process of vaccines, that go on, and so they're going on at a time where we don't need to know that information right away. We're just waiting for the new vaccine to get approved and to use it. The COVID vaccine obviously is different, because again, it's happening while we're in the midst of a global pandemic. So there's a lot of things that we still need to learn, a lot of things that we're still learning. So I think that right now we don't really know. We don't know if then the booster vaccine that we're going to need to get, is it the same as what's out there now, or will it be one of the new ones, that gets created? But as was just discussed as well, we're kind of used to getting booster vaccines. We get our tetanus booster, we get the measles boosters for kids before they start school. So we're used to being boosted. So it's not something uncommon to do that. It's not something unique to the COVID vaccine. So I think that it's more so just something that it's a vaccine that we're just trying to learn and trying to make sure that it's keeping up with how the virus is changing. And I think that's a very important piece, I think, for our discussion, and it has been mentioned. Viruses can be hard to prevent. They can be hard to control because viruses change. And especially as we talk about the flu virus, there's a different flu vaccine every year. It's a different flu vaccine. Now, some of the components are similar to what's in prior vaccines, but we still have to get a different flu vaccine every year, right? So, we don't know that yet for COVID, but what I would say is that the vaccines that we have now, they're safe, they're effective, they're free, it's available, and it's important that we do get more people vaccinated so that we can get to that point where we're not having to worry about COVID. We know it's something that happens, but it's not something that's, disruptive to our lives. It's not disruptive to our kids' lives, and we're able to kind of enter in our new normal, that hopefully is better than it's been before. So I think that's really, the main message is the more that people get vaccinated, the less that we'll have to be worrying about how the virus is changing, while we're trying to do our day-to-day.
Thank you. For our audience, please take a moment to take a quick post-webinar survey and share your thoughts with us. In the meantime, we wanted to thank you, and thank you, all of you, our panelists, our audience, our viewers, for taking the time to be with us today. We're about to have our raffle and we'll announce the winners next, but we wanted to offer a number of resources should you be interested in any next steps. All these resources are up in the slides as well as in the links in the chat for your convenience. Dr. Archibald, would you like to include a video that we'll link in the chat about getting vaccinated and any further information that parents may be interested in seeing, especially with regard to the virus, the spreading, and any serious illnesses?
Yes, I'll definitely add the links in, because there's a lot of great information that's out there.
Thank you so much. For those of you interested in taking next steps and booking your COVID-19 vaccination appointments, we have put up on our website, vaccinefindernYC.gov, where you can find a convenient location near you. If you would like to take advantage of an in-home vaccination, you can visit the website or call the number in the chat. For every vaccine booster appointment, our Vax hotline is now offering free round-trip taxi rides up to $50 to and from each appointment via the rideshare platform in Lyft. We're also sharing that link in the chat to an English and Spanish version of the videos for those of you that are new parents, pregnant, and or lactating. This video was created with you in mind, and the video comes with a COVID-19 vaccine communication toolkit for pregnant and postpartum parents, created in collaboration with VLC and Hunger Free NYC for Health Leads. Next, we would like to introduce to you Christine Wang, PhD, a student in community health and health policy at the CUNY Graduate School of Public Health. She would like to share an amazing opportunity for parents who have not yet chosen vaccination for their children to share their thoughts. I'll pass it over to Christine to share more.
Thank you so much. Good evening, everyone. Pleasure to meet you. As mentioned, my name is Christine Wang. I'm a PhD student at the CUNY Graduate School of Public Health. Thank you all for this informative webinar and the invitation to share this exciting opportunity for you to participate in an ongoing research study that the university is hosting. This research study is looking to learn more about parents' opinions about childhood COVID-19 vaccines. Your opinions, your perspective, your thinking process around how you make decisions around the COVID-19 vaccines for your child. So if you are interested, the steps are very simple. We have English and Spanish versions of a short 2-minute survey. And then secondly, if you are eligible based on the survey responses, the research team will invite you for a 1-hour, one-time interview by Zoom, a video conference, and we will schedule it according to your availability. Once your selected participants have completed the interview, they will receive a $75 electronic gift card for Target. So currently we've been interviewing several participants in English and Spanish. We do have some more slots available for English speakers, but are primarily in need of Spanish-speaking participants to join our roster. So if this interests you at all, to participate in this larger community-based learning process of what drives our decision-making as parents for childhood vaccines, we welcome you to submit that first survey, which we'll put into the chat and also circulate through our existing communication channels. Thank you very much. If anyone has questions, I'll also monitor the chat and respond accordingly.
So it is time to announce our winners for the raffle. Is Gomez, congratulations. Now we're going to spin for the second raffle prize winner of the evening. And the winner is Joyce Park, congratulations. And finally, our third raffle prize winner is Gabriela Lopez. Congratulations, everyone. We hope you enjoy your prizes. You will receive a follow-up email from Anthony with instructions on how to receive your prizes, and congratulations again. In closing, I wanted to thank everyone for participating today. We're so grateful for all of your time and hope you do take advantage of all the resources that we have shared with you this evening. A recording of this event will be available shortly. On behalf of the Vaccine Literacy Campaign, the CUNY School of Public Health, Hunger Free NYC, and Health Leads, thank you all so much and have a wonderful rest of your night.